Good afternoon. This is Samiya Abdi with the National Collaborative Center for Determinants of Health. Thank you for joining us for our second conversation in the series on health equity, determinants of health, and COVID-19. I'll be your host for today's conversation, and I'm calling today from Montreal, the traditional and unceded territory of the Mohawk peoples. The conversation today is being hosted by the National Collaborative Center for Determinants of Health, and we are hosted by St. Francis Xavier University, and our main office is in Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq. The National Collaborative Center for Determinants of Health is one of 6 NCCs. We are all funded by the Public Health Agency of Canada, and each NCC has a very particular mandate to support public health practice across the country. You can find out more about all the NCCs by going to www.nccph, and that's P as in public, .ca, to learn more about the other NCCs. I'm also joined today by my team. You'll see my team members in the chat box, Claire Becker, Thermazim Dardain Okol, and Ashiko Tatim. And they'll be sharing resources and also keeping track of your questions throughout today's session. So thank you all for joining here today. Today is the second in the conversation series, which the NCCDH launched last week. Our intention behind the series is to really provide public health folks like yourself with some really timely evidence about what is happening in terms of the intersections between COVID-19, equity, and a whole host of determinants of health. It is my pleasure today to have 3 amazing presenters with us. Samiya Abdi, who is a Senior Program Specialist at Public Health Ontario, Oudshoorn, who is an Assistant Professor at the Asa Labat Family School of Nursing at Western University, and Anjum Sultana, who is a Director of Public Policy at YWCA. Each of our presenters will be talking about a particular theme. We'll hear from Samiya about the impacts of racialization in the COVID-19 pandemic. Anjum is going to speak to us about some of the gendered impacts and responses we're seeing. And Aid is going to talk to us about the intersections of COVID-19 and experiences of homelessness. When you registered today, we asked you a question. We asked you, how are you seeing equity-seeking communities being impacted by the current pandemic? And you shared some responses with us. On your screen, you'll see a poll which gives you a sense of some of what you shared with us at the beginning of the registration process. A number of you talked about the fact that what we're seeing in the current pandemic is just an increase in inequities which we know already exist in our communities. Lots of folks talked about how different communities have been impacted in terms of income and also working conditions. So really, who gets to stay at home in this pandemic and who gets to continue to work? Folks raised issues around gendered impacts, racialized impacts, housing and homelessness, food security. A few people talk about transportation, things like being able to get to testing facilities, being able to access your basic needs. And a few people talked about other issues. I'd encourage you to share some of those other impacts you're seeing in your communities in the chat box with us. Thank you. For many of us on the line today, we're living an experience we've never lived through in our entire lives. And while we're going through this experience, which is very much a collective experience across the country and across the globe, we're also starting to see very quickly that equity-seeking communities are experiencing the pandemic in very unique ways, in very different ways, and in many ways which actually increase some of the inequities we know already exist. So as we go through today, our presenters are going to be walking us through some of what they are observing in their own practice. I would like to invite our very first speaker, Anjum, who is going to talk to us about what she's seen as some of the gendered experiences and impact of COVID-19. Anjum, off to you.